Hello, my name is Jigar, and today we will discuss about the indigenous people who are the First Nation people. So we group the four elements. My name is Jigar, other than Akanksha, Disa, and Rosni. So we will discuss about this topic in our PowerPoint. So why we choose this topic? We decided to focus on the indigenous community in the Northern Ontario due to their significant health disparities. And other than that, they are facing some challenges like racism, higher poverty rate, lower educational attainment, and the poor health outcome. So looking at about the parameters, we are focusing on the in the northern Ontario, specifically northeast and northwest region. Here you can see that 45% of the indigenous people living in the northwest, and other than that, they are living in the northeast. So we can break down by specific groups. So there is increasing number of the people self-identifying as a First Nation. Greater Sudbury has about 18,000 indigenous people, which increased about 3,000 from the previous data. Now we will look about on the life expectancy, which is 2.5 year lower than the provincial whole Ontario data. Premature deaths rate are higher than the whole Ontario. Looking about the primary access is lower than provincial data. Unemployment rate is higher than the Ontario. Looking about the infant mortality rate is 25% higher in the low income neighborhoods with the complex chronic condition. Rising healthcare demands because of that chronic illnesses, higher mental health disorder and addiction. Major health issues like 21% diabetes rate in the indigenous people, and they have a higher suicidal rate about 42%.
Hi everyone, myself Disha Patel. So, community assessment. Assessment is the first part of the nursing process. In community needs assessment for an indigenous community, identifies the gap between what is and what should be. This assessment is crucial when planning new projects, starting initiatives, or reviewing ongoing efforts to make sure they meet the community needs and use resources wisely. In survey is the part of the assessment. The survey series on indigenous people are addressed to key data gaps and align with important framework to improve community well-being. This data supports targeted actions to better meet the needs of these communities. So what is going on with the indigenous people? Indigenous healing and wellness strategies is being implemented to address significant health and wellness issues in indigenous community across Ontario. What are the strengths and challenges they are facing? So we are going with the strengths. So strong community based approaches with program led by indigenous people, integrated of traditional and mainstream health practices. They have collaboration between various indigenous organization and government ministry. Further challenges, they have a high rates of chronic illness, mental illness disorders, and addictions. They have lower life expectancies and higher premature death rate, limited access to primary care providers and health services, high unemployment rates, environmental issues, and higher infant mortality rate. Capacity building strategies in that they have a training and employment community wellness workers to provide local support and counseling for mental health. They establishing healing lodge and treatment center to address their mental health issues, supporting indigenous partners in building capacity through development support workers, providing ongoing funding and support from multiple governments.
Hi, myself Roshni. Now we are going to discuss about organization and services for this community. So for from indigenous organization, there are some organization like Union of Ontario Indians, Métis Nation of Ontario, Ontario Native Women Association, and so on. There are some government ministries, Ministry of Children, Community Health, and Indigenous Affairs. There are some community services like community wellness worker, healing lodge, mental health and addiction treatment, mental and child health, and indigenous health babies and child program. There are so some gatekeepers and stakeholders for these communities are indigenous community leaders and elders, leaders of indigenous organization, government representative from relevant ministries, community wellness worker, and others health service providers. Communication strategies for to engage with this community are like engage in respectful and culturally sensitivity dialogue with community to understand their needs, collaborate with the leader of this community to ensure community buy-in, a regular meeting and update with the government plan to secure funding and support, use community form and social media to keep a community informed and involved in engagement, employ community wellness worker to facilitate communication and provide feedback from grassroots level. So whose idea and voice may not be heard regarding this issue from this population is like elder people, children, women, and people with disability. This group may encounter some challenges like transportation, lack of child care, and language variation because of they are not fully participating in communication.
Hello, my name is Akanksha, and next we are going to talk about methods for including neglected groups in community assessment procedure. First one is focus group. We can arrange small and safe cultural appropriate focus groups with a special focus on women, elderly, and those with disabilities. Next is one on one interviews. We can get in depth information from people who might not feel comfortable speaking in front of groups for conducting one on one interviews. Next is meeting with the community. We can organize open, friendly, and inclusive community gatherings for everyone in the community. Next is including local leaders, working together with community organizations and local indigenous leaders to identify and reach out to the communities. Next, we have strength and limitations of the approaches. In strength, focus groups and interviews provide personal perspective that highlights specific needs and challenges faced at the family, community, or national level. And in-depth understanding by involving local leaders and um, participation and trust can increase with that. Next is limitations. First one is limited representation. It's possible that focus group don't correctly represent the variety found within the indigenous population. And in group dynamics, quieter members may be overshadowed by dominant participants, which can cause imbalance in information gathered. Next, we are going to talk about what strategies may not give. First one is comprehensive quantitative data. We might not have the comprehensive quantitative data required to detect larger scale community trends and patterns. There's also a chance that some people or groups cannot accomplish this because of the obstacles like language and accessibility issues or cultural differences. Next is immediate implementation. Collecting, evaluation, and interpreting qualitative data can take time. These methods might not offer actionable information and answers right away. Next are approaches to think about. First one is surveys and questionnaires. Next is community involvement and digital platforms. Ethical considerations and advocacy. In Northern Ontario, advocating for Indigenous population involve addressing systemic injustices and promoting cultural competence, assisting with self-determination, respecting rights of Indigenous people by obtaining informed consent, uphold confidentiality are examples of ethical issues. And we can build mutual respect and trust, being the nurses that can identify in combating with anti-indigenous racism. Lastly, what have you as a group learned about the vulnerable group? In community assessment of Indigenous people in Northern Ontario, our group has learned about significant health issues faced by Indigenous people, higher rates of chronic diseases, limited access to healthcare services, and socio-economic hardships all have an impact on overall well-being. During this process, we realized the importance of cultural competence and anti-racist practices in community nursing to improve health outcomes. Next, these are the references that we used in our PPT, and thank you.
Thank you.
Thank you.